Good evening, class. My name is George Alonzo, and today I'll be talking to you about my facilitation technique. My facilitation technique is called sensory integration. Sensory integration is a form of a sensory intervention that intends to develop new or adaptive wiring in the brain and central nervous system in order to successfully interact with the environment. The goal of the intervention is to improve the ability of the individual to process and integrate sensory information and to provide a basis for improved independence and participation in daily life. There are three basic principles of sensory integration. Number one, learning is contingent on the ability to take up sensory information and integrate it in order to plan and organize behavior. Number two, deficits in processing and integrating sensory information results in deficits in planning and organizing behavior. And number three, the ability of the central nervous system to process and integrate sensory information can be improved by exposures to increased and enhanced sensory experiences. The purpose of the sensory integration is to help patients to develop one or more of the following senses. So we are taught at an early young age about the five common senses, which are sight, sound, touch, taste, and smell. But there are two other senses that we don't hear as often, and the first sense is the vestibular sense. The vestibular sense detects movement and gravitational pull, and it provides information regarding the position of our head, so having to do with balance. The second sense is the proprioception sense, which is the sixth sense, and that informs our body position in space. The population that this intervention is intended for are patients with dementia, patients with developmental disabilities such as autism, patients with TBI, traumatic brain injury, patients with schizophrenia, patients with HIV/AIDS, and patients with pain, chronic pain. The sensory integration was developed by Jean Aris, who was an occupational therapist and an educational psychologist. She developed a theoretical framework, which was a set of standardized tests, which today are known as the sensory integration and praxis test. She used sensory integration to treat children and to aid child development by using the proximal senses, which are vestibular, tactile, and proprioceptive. A great way to administer sensory integration is through multisensory environments. These multisensory environments are known as the snoozelen room. This room offers clients with sensory processing disabilities with a safe environment that uses gentle sensory exposures meant to enhance pleasure with no direct therapeutic goals. By having no goals, it leaves the snoozelen room experience open to endless possibilities. Sensory stimulation in that room can be manipulated, intensified, or reduced in relation to the needs and desires of the individual. The snoozelen room can be used for arousal, relaxation, development, and stimulation. For relaxation, it offers a calm environment to reduce agitation through the use of gentle light, soothing sound, relaxing smell, and touch. For development, it is a learning and developmental tool used for color matching, understanding cause and effect, and creating themed environments to teach within. Lastly, for stimulation, it provides exciting visuals, music and sounds, invigorating smells, and textures to explore. The snoozelen room is either black or white. When it's white, image projections are able to be seen clearer than in black rooms, and when the room is black, it is best used to expose the clients to neon and bright stimulating colors. In order to offer a successful treatment using the snoozelen room, it is best to have a safe and predictable environment. Also, keep it constant and consistent. The personal space of the client must be honored. Control the temperature and the color of the room. Demand free. No questions are able to be asked from the patient. No direction or instructions given. The goal is to give the client freedom to engage and focus on their favorite things of the snoozelen room. Some activities that activate the senses are finger painting for the tactile sense, hearing music for the auditory sense, picture games for the visual sense, and aroma guessing games for the smell sense. In the snoozelen room, there are a variety of equipment that make the room so successful. This includes fiber optics, which breaks perceptual barriers that people might have, bubble tubes, providing multisensory feedback and stimulates the visual system, allowing to facilitate clients' ability to track bubbles and objects. projections, which promotes relaxation through visual engagement, providing endless possibilities, controllers and switches, which help motor skills and help relay information about cause and effect, and panels, which promotes hand-eye coordination, range of motion, and color recognition. The three disabilities that best fit for the multisensory environment snooze in a room are the behavioral disabilities, dementia, and traumatic brain injury. When people experience life changes and finds it difficult to cope, negative thoughts can build and emotion can be displayed, expressed in ways that society finds hard to cope with and understand. There are many difficult behaviors that services encounter, including chewing and eating non-food items, spitting and screaming and shouting, hitting and swearing. Service users can pose a risk to others or harm themselves. Restructuring thinking patterns via talking therapy may be a solution, which can take place in a traditional multisensory area with inclusions such as mirror balls, projections, bubble tube, music, all selected to calm and soothe the individual receiving the therapy. Clients, however, may opt to create a very different intervention, such as de-escalation spaces for their service users who have more complex needs. These might be rooms that have thick cushioned walls and floors and can be considered controversial by some. These spaces enable individuals who want or need to engage in throwing their bodies against the floor or wall or seek repeated impact with a particular part of their body to self-soothe or obtain proprioceptive tactile input. For example, fist or head, for example. To do some in a safe place with the minimum possible risk, some of these rooms may include calming elements such as color lighting, music, or scent that can be chosen by the service clients who experience a buildup of anger and feel that they want to hit at something or at sensory seekers, and do so for self-management may find interactive wall panels useful. The second population that would find it useful is patients with traumatic brain injury. Engagement purely at a sensory level, the equipment can be used in a variety of ways purposely to target tactile, visual, olfactory, or audible senses. The space may also be used to calm and soothe and provide a personalized environment where someone feels safe and comfortable to share confidences, or used as a place to learn new communication techniques. Fundamentally, the room needs to be designed for inclusivity, ensuring that everyone, regardless of mobility need, can access and carry out various activities, whether using walking frames, wheelchairs, or requiring transfer via mobile or ceiling track hoists. Purposeful design and planning is required to serve the needs of this client group effectively. For example, enabling safe transfers, which may require inclusion of platforms for staff to use mobile hoist, ensuring clear paths and planning seating areas in conjunction with ceiling track hoist, and carefully considering the width, height, and depth of seating areas so that the client can be transferred and positioned near equipment that can see, touch, and interact with. The last population that best serves for the snooze in the room is dementia patients. Dementia describes progressive disorders affecting the brain, such as Alzheimer's disease, vascular dementia, and dementia with Lewy bodies. These conditions present problems with thinking, mood, behavior, and the ability to take part in everyday activity and leisure. If no suitable activities are provided and people living with dementia have nothing to do, they might become increasingly isolated, frustrated, and unhappy. However, choosing the most suitable type of activity for people in the mid to late stages of the disease is challenging. So, given those people may not be able to participate in hobbies enjoyed in the past, it may be sensory side of the activity that needs to be supported. Sensory activities also provide a level of stimulation, which increases awareness and attention due to the simplicity of the task. Matching the sensory demand of the activity with a well-designed environment will help the person with dementia to take part. Auditory stimulation is very effective for mood enhancement, relaxation, and cognition. It includes a wide range of music ranging from natural sound, bird song, waterfall, urban environment, to generate a sound as music. So for the next part of the video, I'm gonna show you the implementation exercise of a client in a snooze in a room. I hope you guys enjoy.
kept you